Welcome to Veterinary Dental Radiographic Interpretation. This is a 5-part webinar series, and I'm Brett Beckman. So we'll get started on recognizing mainly normal and some aberrations to normal. We'll touch on some of the abnormal anatomy. We'll look at a little bit of a peek into pediatric radiographic anatomy, and then also talk about interpretation of positioning, right or left, and we'll finish up in 50 minutes to an hour, very likely. So let's take a look at this first image. This is the right mandible of a dog. You've got the first molar here that we'll use as an example of what we're looking for as far as normal radiographic anatomy. The first thing that we'll look at is the marginal bone level, and that is the most coronal level that the bone exists that we can see radiographically. So we can see here the marginal bone at this level in the furcation all the way up as it's supposed to be normally here as well. These are normal bone levels for this tooth. We expect that bone level to be just under the neck of the tooth, just under the crown, as you see here. And any deviation from that is abnormal. And we'll show you some early changes in periodontal anatomy in this segment. And then we'll touch on that more deeply as we get into the periodontal pathology in a separate hour of the course. So one of the other things that we need to look at anatomically is the crown of the tooth, and so let's look at some of the radiographic anatomy that we might expect based on location in the oral cavity. This is a cat right maxilla. And if you'll notice, the infraorbital foramen is here and the zygomatic arch is here, and radiographically we're going to see this zygomatic arch superimposed over the crown and or the root of these right caudal maxillary teeth when we take this image. Now the tube head in this case is going to be directed so that it's above the angle of the horizontal plane, about 30 to 35 degrees. So by doing so, it drops that zygomatic arch down relatively radiographically. And so we're going to see that superimposed over the root structures here. Now, generally that's not a significant problem clinically. Very rarely do we use other imaging techniques like extraoral techniques to eliminate that zygomatic arch from its superimposition over the tooth roots. We can alter the view slightly if we need to discern areas such as this where there's a lot of superimposition, although we can actually even see the periodontal ligament space through that superimposition of this palatal root. So in most cases, this is not a significant problem. We would expect the infraorbital foramen to start about in this area, and then the canal itself would be superimposed over the roots and all of this bone and all the cancellous changes that we see there. So we wouldn't discern that specifically many times.